pediatric cancer, by definition, is a rare entity. So it accounts for only 1% of all cancers. So in itself, all childhood cancers should be considered rare. But then within pediatric cancer, we have the common cancers that everyone talks about, brain tumors, leukemias, lymphomas, some sarcomas. And then we have the less frequent cancers that we call rare cancers, that usually are those that tend to either look very much like adult cancers, and therefore people assume that these are the same as in adults, and so nobody pays too much attention to those. And then we do have those others that are true, unique pediatric cancers, but are very rare. And so for those two groups, those that actually happen to be adult cancers occurring in children and those that are rare pediatric cancers, research is lagging behind. So there have been very few advances over the years just because of sheer numbers, because it's very difficult to pull them together, difficult to get clinical trials. And this is how we advance in clinical oncology, through clinical trials. So it's been very difficult. But the Children's Oncology Group, 10 years ago, decided to focus on rare cancers and put together a committee that is the Rare Tumor Committee. And so there we have tried to put together all the initiatives that are necessary to advance the field in rare cancers. And so we consider, liver tumors as part of those, the germ cell tumors are part of those, and then the true rare or infrequent, which are carcinomas. These are, so they have an idea, cancers that we may see just 20 or 30 or 50 a year in the United States, right? If you compare that with, say, 300,000 cases of, say, breast cancer or colon cancer, you can get an idea of how rare these cancers are. And yet, we have been able to put together clinical trials for those and learn from those, put together treatments that have been validated, and then even biology studies that have allowed us to understand better what these diseases are.